Cases of monkeypox have been reported across the U.S., bringing the count up to at least 72 cases in the last month. Now, one of the World Health Organization's top officials is calling the virus a real risk to public health.
The magnitude of this outbreak poses a real risk. The longer the virus circulates, the more it will extend its reach, and the stronger the disease's foothold will get in non-endemic countries.
Now, that warning comes as the WHO prepares to meet next week to discuss whether or not the spread of monkeypox should be considered a global health emergency. Let's bring in Dr. Amesh Adalja for more on this. Dr. Adalja is a senior scholar at Johns Hopkins Center for Health Security. Always great to have you, doctor. So what do you make of this new warning by one of the World Health Organization's top officials? Should people be worried about a potential outbreak larger here in the U.S., even though cases do remain low at this point?
Anytime a virus is behaving differently than it has in the past is a cause for concern. And it's really important to then put a halt to that new type of transmission. And that's what's happening with monkeypox, that it's transmitting outside the endemic area, person to person. And the epidemiology is different. It's transmitting in sexual and social networks. But the key thing to remember is it's still not a very transmissible virus in terms of comparing it to a respiratory virus. It doesn't have pandemic potential. The goal is just to get our arms around the epidemiology, find cases, contact trace, and use the vaccine. So I don't think this poses a major risk to the general public, but the longer it goes on, the longer it's going to be hard to stop it from spreading in those networks. And I think that's why the WHO is paying so much attention and convening these meetings.
Now, this week, the CDC issued new guidance on monkeypox symptoms. According to the agency, recent infections are actually showing different symptoms than in the past. Like you just said, kind of interesting that it's behaving differently now. It includes a rash in the mouth or around the genitals or localized lesions in areas other than the face, hands, or feet. How unusual is this? Are we seeing this virus mutate?
So it's not the virus that's mutating, it's the social network that it's gotten into and the way it's transmitting amongst individuals in that social network. As we said, this has been kind of masquerading as a sexually transmitted infection. And a lot of the contact is from people being in intimate, close contact where there is skin-to-skin contact. So that's why we're seeing genital lesions. That's why we're not seeing the traditional rash on the face, the hands, the feet that people saw when primarily they were getting infected by animals. This is happening from close person-to-person contact. And that's responsible for why the rash is appearing in different parts of the body and responsible for why this had not been recognized for some period of time because it was being diagnosed or sexually transmitted infections.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.